Here's an example in medicine where if your timing is off, your results can be really bad as well. I did a prior video where I talked about the key about the window of opportunity, about treating an autoimmune condition when you first catch it so you can prevent it from progressing and prevent damage. In that case, I talked about someone who we caught them at an early stage and I expect them to do really well long term because we're catching their condition early on. Here's an example of where we caught somebody early, the window of opportunity was correct, but unfortunately this individual did not appropriately follow up with treatment, which then led to a much worse outcome for them. So in this unfortunate case, this was a man who I first met in his early 30s, diagnosed with rheumatoid arthritis based on his symptoms, his exam, his antibodies, inflammatory parameters, and his ultrasound findings. When I first saw him, he had early rheumatoid arthritis, but it was still at an early-ish stage. And so my recommendation was to treat him in a mild manner with medication that is mild, as well as some over-the-counter joint supplements, and let's keep a close eye on it. At that time, he agreed to do that, but didn't actually pursue treatment, and I didn't see him for about a year. When I next saw him, it was a year later. He had not pursued treatment, and now his condition was a bit worse, meaning he had a few more joints that were active. In addition, now his ultrasound findings were a little bit more aggressive, where now it went from being relatively mild changes on his ultrasound of the hands and the wrist to now he had a little bit more inflammation now. At that point, I told him, look, I think we now need to push treatment a little bit harder. We need to use something stronger than what I'd recommended prior, a moderate level medication. Let's use something like that to get this under better control. At that point, he agreed. And again, plan was to pursue that and get this under good control. He was still within that window of opportunity to get a good result. Unfortunately, he didn't pursue treatment. Again, he sort of got scared off from that. And because of that, I didn't see him again for another year. He then presented a year later, and now his condition was dramatically worse. It was now severely active. And when you looked at his ultrasound, he had not only severely active inflammation, now we had chronic damage in the joints, things that we can't reverse. And so at that point, my recommendation was, look, your condition has now progressively gotten worse. Now you should be using something even stronger in terms of treatment. Again, win that conversation with him about risks and benefits of treatment. He came to an understanding that, okay, I'll consider this. Let's proceed with treatment again. Unfortunately, again, he didn't pursue treatment. And this time, this was again another year later, and now his condition had even progressed further, where now he had more damage in the joints. He had some functional limitations in some of the joints, his hands and his shoulders and his knees. And in addition, now he was developing also metabolic syndrome. Because of his chronic inflammation, he was at that early stage where he was now starting to develop some cardiovascular issues as well. Unfortunate, because all of this probably could have been treated, controlled at an earlier stage at his condition. In this kind of case, even if you're catching someone at a later stage, you can still control their active inflammation. You just can't reverse all the damage that they've developed over time. In his case, he made some decisions that were not in his best interest. Even though we discussed this concept of the window of opportunity and timing, this is an example of where if you miss that timing, your results can be a lot worse. So timing is everything in life. And if you have a chance to really control something, prevent something from getting worse in life, and it's done in a way where it's in a reasonable risk manner, but with a very high level upside in terms of outcomes, strongly consider that. And if you're not comfortable with that option, speak with your physician, get further clarity. The worst thing that you can do, in my opinion, is that if you let something progress and it's because there's some either miscommunication or concern on your part, and it's not something that you pursue in terms of follow-up conversations and follow-up in terms of treatment. In my patient's case, in this regard, I haven't seen him in a few years. I hope he's doing well. I hope he's pursuing treatment. I hope he's not only controlling his joint issues, I hope he's also preventing the progression of any metabolic or cardiovascular issues as well because of chronic inflammation.